My grandmother always taught us that your health is your millions. And so I'm going to believe that until the day I die, because I'm not going to have, technically, I'm not going to have millions of dollars. And so for me, in my case, my millions are my health. She's absolutely right about that. And that's a lesson that I'm going to take to my grave. My health is my millions. Grandma's right. Thanks, Grandma. I appreciate it. So coming from that perspective, I'm listening to the Ron Paul Liberty Report, and it's just one video after the next for days, weeks, and months on end about the coronavirus. And if you read down the comments on any of these videos, check them out yourself, you're going to see it's a hoax, it's a scam, it's a pandemic, it's fake news, there is no virus, there's no effort ever made to correct any of these people. And we're not saying that the virus is a sham, we're not saying that the virus is a hoax, we're just disagreeing with the state's reaction to that virus. If that were the case, that would be the correct course of action to take. But I don't even know if that's the case. I think that maybe they actually believe too. Daniel McAdams, Ron Paul, Chris Rossini, other people, Dr. Mercola, a lot of the other people that they've had on their show, they might believe that this all is a sham or a scam. I don't think anybody likes this. I don't think anybody wants the economy shut down. I don't think anybody wants to see mom and pop businesses going bankrupt, closing their doors, going out of business. It's just terrible. I don't think anybody wants to see any of this stuff, and yet here it is. And so the government response to this is there's a lot to be argued about it back and forth one way or the other. Do we do this? Do we do that? But it seems the way it's coming from, the Ron Paul Institute or the Ron Paul Liberty Report, and God love him. He's the best politician we've had in my lifetime. He's probably the best that we've had in 100 years. I think he's one of the most principled men ever to have served in Washington, D.C. politics. And I hope he has a full recovery. I would be just heartbroken if anything else were to happen to him after this health scare that he's had. But putting all the praise that Ron Paul deserves aside for a second, we disagree with the quarantine. We disagree with the shutdown. We disagree with the masks. We disagree with the social distancing. You disagree with all of that. So there's very, very little to agree with. So the question is begged, well, what do you do? What do you want to do? It's like you're against everything. What do you agree with? What are your solutions to the problem? And then I hear Rand Paul get up and start questioning Dr. Fauci about herd immunity. Well, I guess if Ron Paul is going to follow Rand Paul, you just want to have herd immunity. You want to be like Sweden. You don't want to compare Sweden to Finland and Norway and Denmark and these other Scandinavian and Northern European countries. You want to compare Sweden to the United States and say, well, Sweden is, in the ballpark in their results with the United States, and yet they didn't impose any of the restrictions on their society and their country that the United States did over here. So therefore, if we didn't do anything, if we had no response at all, our results would be exactly the same. We'd be just like Sweden. If Ron Paul thinks like Rand Paul, and you want to have herd immunity, we're not there yet.
Dr. Fauci, today you said you are not for economic lockdown, yet your mitigation recommendations from dating to baseball to restaurants to movie theaters have led to this economic lockdown. Do you have any second thoughts about your mitigation recommendations, considering the evidence that despite all of the things we've done in the U.S., our death rate is essentially worse than Sweden, equivalent to the less developed world that is unable to do any of the things that you've been promoting? Do you have any second thoughts? Are you willing to look at the data that countries that did very little actually have a lower death rate than the United States?
Senator, I'd be happy at a different time to sit down and go over detail. You've said a lot of different things. You've compared us to Sweden, and there are a lot of differences. And you said, well, there are a lot of differences between Sweden, but compare Sweden's death rate to other comparable Scandinavian countries. It's worse. So I don't think it's appropriate to compare Sweden with us. Yes, we have, I think in the beginning, we've done things based on the knowledge we had at the time. And hopefully, and I am, and my colleagues are humble enough and modest enough to realize that as new data comes, you make different recommendations. But I don't regret saying that the only way we could have really stopped the explosion of infection was by essentially, I want to say shutting down. I mean, essentially having the physical separation and the kinds of recommendations that we've made.
You've been a big fan of Cuomo and the shutdown in New York. You've lauded New York for their policy. New York had the highest death rate in the world. How could we possibly be jumping up and down and saying, oh, Governor Cuomo did a great job? He had the worst death rate in the world.
No, you misconstrued that, Senator, and you've done that repetitively in the past. They got hit very badly. They've made some mistakes. Right now, if you look at what's going on right now, the things that are going on in New York to get their test positivity 1% or less is because they are looking at the guidelines that we have put together from the task force of the 4 or 5 things of masks, social distancing, outdoors more than indoors, avoiding crowds, and washing hands.
Or they've developed enough community immunity that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
What is that going to do to people like you? What is that going to do to people in their 80s? Is herd immunity what you really want? Because if you really want herd immunity, in order for you to be a cow in the herd, you have to get infected with this virus too. And is that really what you want? Do you want to get COVID-19? I understand Rand Paul has already had COVID-19, if that can be believed. Does he want to get it again? You know, at this early stage, if you want to err, let's err on the side of caution. Let's figure out what the hell we're dealing with first, because we still don't know. There's a lot, even still, it's September 27th. There's a lot that we have to learn about this virus. Let's learn. Let's figure it out. Let's figure it out. Let's know our enemy and figure out what we're up against here, and then we can decide, you know, how little restrictions we want to place on ourselves, how much freedom we want to have, how much risk we want to take. We don't have enough knowledge, we don't have enough of a grasp of this thing yet to decide how much risk everybody in society should take. Now, I don't agree with any of these restrictive policies from Washington, D.C., but that's a far cry from believing that the virus is a hoax. That's a far cry from, disagreeing with everything. That's a far cry from, me considering the possibility that I might want to wear a mask when I go out in public, that I might want to socially distance, that I might want to logistically plan my day so that I minimize the time I'm spent out in public and I maximize the efficiency of me getting everything that I need to get with as little exposure as possible. I don't need somebody from Washington, D.C. to force me to do these things. I'm going to want to do them anyway because it's just the smart thing to do. And, another thing is the vaccines. The vaccines are coming down the pipe. If Joe Biden is going to be president in 2021, we are going to face a future, and it's right around the corner. This is months away, probably not years away. We're right around the corner where we are going to have state-sanctioned vaccines. We are going to have mandatory federal mandates and mandatory vaccines where our citizens are going to have to go and get injections of God knows what, with God knows what side effects. Ron Paul and the Ron Paul Liberty Report has been very defensive of the Trump administration lately. So do you agree with that? I haven't heard any criticism of this warp speed. Is that what you want to call a vaccine program when you're trying to formulate a vaccine to this virus, which isn't going to work? Just like every other human respiratory coronavirus in the history of man, we've never had a vaccine, and even if we do have warp speed, and even if we do have every major pharmaceutical company in the world working on a vaccine for it, it's not going to be effective. We're going to vaccinate for last year's coronavirus. We're not going to vaccine for the coronavirus that we have right in front of us that it's mutated to in 2021. Maybe it'll be a less virulent strain. Maybe it'll be a less lethal strain. We're poo-pooing on the masks. We're poo-pooing on the social distancing. We're poo-pooing on these non-medical efforts that make sense. They're just common sense. Logic would dictate that if you don't want to catch an infection, you don't become exposed to it. And these are common sense approaches to limit our exposure to a virus. Even if we do get small contact with it, we're not going to get a big viral load. We're not going to get just gobs of it up our nose or gobs of it down our throats. We are just going to get exposed to a small amount of it. Hopefully then these strengthened immune systems that we're talking about from Dr. Mercola and whoever else, which is also a very good idea, then our strengthened immune systems will be able to fight this thing off just like a common cold and defeat it, and we're not going to have any permanent heart damage. We're not going to have any permanent lung damage. We're not going to have any long-term inflammation of the brain and brain damage. We're not going to have any heart attacks and strokes. And all of this is going to happen while we're figuring out what the immunity to this thing really is. If we do get infected once, how long are we going to be immune to it? For how many months? For how many, is it going to be 6 months of immunity? Is it going to be 3 months of immunity? 9, 12 months? Is it going to be a couple of years? Is it going to be 60 days? We don't know. We don't know, and we need to know. This is one of the big things that we need to learn, especially when they're showing signs, when people, it's coming out in the data that people are showing signs of long-term impact to their health. Maybe permanent, it might be lifelong. Do we have this inflammatory conditions now that are going to be with us for the rest of our lives, that our hearts are going to remain inflamed, every day, every week, every month, every year for the rest of our lives? What is that going to do to our lifespan? How long are people going to be able to live in a state like that? This is serious business, and teaching people to think that it's not, teaching people to think that it's a myth or a hoax or a joke or a pandemic or whatever you want to call it, is not the right approach. Now, if this is what we're going to do with what we're doing for ourselves right now, government force or not, and I would much rather prefer no government force at all, but government force or not, if this is the approach, or if this is how we're going to think and behave and react to the approach that we have now, if you don't want to do any of this other shit, you can go get your injections. You can go stand in line, get your Mike Pence MD injection, get your Kamala Harris MD injection, and take your chances with that and see what that does to you. See what the side effects are to that. Whatever adjuvants they're going to put in there, aluminum, formaldehyde, that's going to be a much bigger problem next year. And that's independent of the virus. It's independent whether you get sick or not. In fact, they're going to be targeting the people who didn't get sick. They're going to be targeting the people who haven't. And as far as this herd immunity goes, the vaccine fits neatly into that scheme because that's kind of the vaccine theory, is herd immunity. We're going to expose you to this thing. We're going to give you either a dead version or we're going to give you a very tiny taste of it. Is that what you want? Are you not looking ahead in time of what's coming right at us? This is coming right at us. And there isn't that much time left. And we need to get a hold of ourselves. We need to figure out what the hell we really think about this and what the hell we really want to do. Don't just sit there and do nothing. Don't just refuse to react because you think it's a joke. If you have good answers on what to do, spend some time on the Ron Paul Liberty Report, sharing those, a note of positivity. That's all I ask. Tell us what we should do rather than what we shouldn't do, which at this point seems to be damn near everything I can think of, or anything that actually makes sense that we should be doing to keep ourselves from getting sick and dying from this damn thing. Looking at the global coronavirus statistics, the global death rate is now 3.85%. The United States still leads the world in the number of infections, the number of deaths, and the number of recovered. United States is now number 10 in deaths per million, or deaths per capita, at 642 deaths per million. United States is number 12 in the number of infections per capita, or infected per million, which is now 22,609 per million Americans have been tested as infected with the coronavirus.